Good evening, everyone, and welcome to the SNAP Clarity and CMAP Health mental health support group for COVID-19. Today, we have a very interesting and very relevant topic, parenting during the times of COVID-19. And we have an excellent speaker, Professor Pat McGrath, who is a professor of psychology in Dalhousie University. Pat wears many hats. He is a pioneer in the field of treating children with pain with psychological techniques. He's also set up a social enterprise called Strongest Family, which serves families across Canada, and the work of this institution has spread beyond Canada to Europe as well. It supplies parenting advice, therapy for anxiety disorders through distance, through phone and internet. And Pat has won the Order of Canada for his really life contribution to children's and parents' mental health. Pat and I have been involved in a number of research pieces of work on internet-based mental health, and Pat's overriding passion is to make mental health available easily to people in all corners of Canada and further on in the world. Pat is also currently involved in a startup company which is supplying healthcare information called 90 Seconds Health, and you'll be able to see this in the next few days. So welcome, Pat, and we're looking forward to hear from you about parenting during COVID times.
Thanks very much, Sanjay, and welcome to this webinar. I'll just share my screen now. You'll see my slides. So we'll see my slides. I'll try again. Okay, the first slide just advertises the and I'm trying to get off the first slide. That's my problem. So you'll just have to bear with me as I figure out how to do this. There we are. So as Sanjay mentioned, I'm a clinical psychologist. I work at CMAP Health here in Ottawa. I'm a professor of psychiatry, work with 90 Second Health, and also with Strongest Families. What I'll share this evening is I'll review how scientists and psychologists think about parenting, and then discuss specific issues related to parenting during a pandemic. And then I hope that there'll be a lot of questions and comments. So one of my patients last week mentioned to me that she had come up with a new word that when people ask her how she is, she says, "Oh, well, I'm COVID fine." And I think we have to understand that during a pandemic, there's lots of challenges, and there's no way that we're always going to be completely okay. We're not going to be quite as okay as we were before the pandemic, before all of the restrictions. And we need to accept that we are COVID fine. During COVID, the families are under a great deal of stress. There's drastic changes in the home life. Parents are schooling their kids at home, and the kids are at home 24/7. The parents may be working at home, trying to do work on a way that they're not familiar with, and it's challenging. There are some advantages, of course. You don't have to commute, but working at home presents its own difficulties. And many of the situations that parents find themselves in, they're trying to do all of these things at once. There may be financial uncertainty. There may be situations where you're not sure that your company is going to reopen after the pandemic. You may have some temporary assistance from the government, but it's really difficult. And the fear of infection. If you've already had a little bit of a fear of infection, maybe you're a little bit anxious about your health, COVID you get 1,000 or so demands each week that you should wash your hands, avoid being near people, and whatever you do, if you don't do that, you're going to get a terrible infection and something terrible is going to happen to you. The other thing, as I was mentioning, is the fear of infection. Many people have some health anxiety, and what the many exhortations to be careful and the very realistic and positive ways to avoid the infection also play on our fears. And so many people who had maybe a very small touch of health anxiety are now having a lot more. Most of us have been quite isolated, and we are only able to many of us don't have opportunity to go and visit our parents, if they're especially parents who are in facilities where they're all locked down. And of course that plays on our fears, because we know that there's been a disproportionate number of people in these facilities who get the virus, and of course older people are at higher risk. So the isolation plays on us and makes it more difficult. We're all in close proximity. Whereas before we would be able to have the kids go play outside on the street, we'd be able to go for a walk, much easier, go to the store. It's a lot more difficult, and there's just no relief from each other. Quite as okay as we were before the pandemic, before all of the restrictions. So the isolation plays on us and makes it more difficult. So I'm hearing my recording, and perhaps we can do something with that. We'd be able to. Thank you. So there's a lot of chaos going on. We have and things are. Everyone is more likely to be short-tempered, and I don't think that that's part of being COVID fine. We have to accept that, and then pay attention to ourselves and give ourselves a little bit of a break, but also give everybody else a break and try and control our irritation, understanding that it's probably not coming from them, it's probably coming not from us, from them, it's coming from the situation. So I wanted to first start off about different theories of parenting. And I really want to talk about, first of all, the most influential theory of parenting there is by Diana Baumrind. She was a developmental psychologist. She lived from 1927, just died in 2018. Her whole career was really spent at the University of California in Berkeley. And she suggested that there were 3 styles of parenting. And this wasn't just something that came out of her imagination. This was something that she actually developed out of research. So the first style was authoritarian. And basically, that's the style, for instance, that I grew up with. I'm a bit older than many of our listeners, and my father was an authoritarian. He said, you do it because I am the parent, and there's no questioning my judgment, my belief. I am the father, you do what you're told. And it wasn't angry, it wasn't in any way negative, except that was the law. The second thing that came in and was often blamed on Dr. Spock, the fellow that wrote the book on child development, and is called the permissive style. And permissive style is just basically, well, you let them be kids and you don't interfere with them. And if they feel like running around, they feel like running around. If they feel like putting their fingers in their spaghetti, you let them put their fingers in their spaghetti. If they, and you basically want to encourage their growth. And this was very popular in some quarters in the last generation. And still you see it, that people who just want to encourage their kids. And then the third style that Diana Baumrind suggested was authoritative, the firm, flexible, and warm. So, I have on the slide a suggestion, well, let's clear the toys up before our story. And so you set standards, but there's a lot of warmth as well. And these are the 3 original styles of parenting that Diana Baumrind suggested. Now, it's been expanded a lot, and especially the keeping the authoritarian and the authoritative. And you can see on the slide some of the different words that might be describing authoritarian and authoritative. So authoritarian might be restrictive, punitive, strict, parent-centered, non-negotiable, and expectations of obedience. And so that type of style is said to be high on demands, low on warmth. Or, that's the thing, is high on demands, low on warmth. Authoritative, negotiation, explanation, promotion of independence. Supportive is high on both on demands, you make high demands, but also you have high warmth. And so that the whole idea is that those two haven't changed from Bowman's original idea, but then the permissive has been divided into two different groups. One is uninvolved and the other is permissive. And the uninvolved is that where the parents disengage from their children and they're not very warm to them, so that they have this distant sort of relationship with them. There's no controls, but there's also few demands. There's lack of encouragement and there's lack of warmth. And it's really a form of neglectful parenting where the kids are just there and you might provide them with food and shelter, but not the type of warmth and caring and not the type of expectations that you would hope for. So, and then the permissive is, again, much like I described before. The child is in charge, the child is indulged, no demands, no boundaries, no direction. This is the classic spoiled child. Now, some people think that you can spoil children with too much love. And of course, you would know from our discussion so far is that if you gave a lot of love and the expectations, you'd be in the authoritative area, not in the permissive area. So the permissive parent doesn't have expectations, is very warm and caring, whereas the authoritative parent has lots of expectations, puts demands on kids that are developmentally appropriate to their age and their abilities, and makes expectations part of family life. So those are the four types that have been most widely accepted as describing parental style. And this style then is translated into specific behaviors that we do. So as I mentioned before, and I just want to reiterate the issue of the extra challenges under COVID. There's a small space, many people. If you have a small house, it's a lot harder to be a good parent at the best of times. And it's because the kids are underfoot. In COVID, it's even more difficult. If only one parent is managing the kid, even if that's because the other parent is absent at work or absent because of separation or divorce, then that's more difficult. If you have a high risk for something, like if you have an elderly member of the family in a care home, that's going to weigh on you. That's going to give you an extra challenge. If a family member is immunocompromised, that too is going to give you an extra challenge because you'll be worrying more about that. And of course, family members working in essential services, if your other parent is working in essential services in healthcare on the front line, or in groceries or in pharmacies, or if they're first responders, you're going to be a little bit more on edge. It's going to be a little bit more difficult to be the type of parent that you want to be. And of course, if someone in your family has had COVID-19, you're going to be overly sensitized to that. So there are situations where there are extra challenges, and I think we have to recognize that. So I'm going to talk about some specific issues. I'm going to talk about establishing family routines, separate spaces, signaling different roles, using positive discipline, both positive to negative, the 5-to-1 rule. I love that rule. Noticing good behavior, don't sweat the small stuff, problem solving. I'm going to talk about punishment. Sometimes we think that punishment is the only part of discipline, but it's really a small part. I'm going to talk about family meals, which are probably more happening more under COVID, and family meals are very important. I'm going to suggest that we have to be gentle with yourself. Self-care is important. We should limit and monitor social media with our kids, and we should also limit alcohol and recreational drugs. Those are the topics that I want to cover tonight. So establishing family routines. It's really important to establish a routine with the family during this type of situation. And I've talked to many people that started off with no routine, and that's fine. You know, when this first started, all of us we're sleeping in or we're doing something different, but quickly became clear that establishing a routine is really, really important. And this should be done with the members of the family if you're doing an authoritative type of approach to parenting. So you want to have the same routine. You can vary it for needs, but basically you want to know that you're going to wake up at the right time, and it's better not to let kids sleep in. Have breakfast, preferably breakfast that's nutritious and together. Morning activities, a break, continued morning activities, lunch, and so on. It's a good idea to post something like that on the fridge, or somewhere where everybody can see it, and so people know when they're supposed to be doing things. You can vary it, but it's a good idea to be varying from a routine rather than trying to make something out of chaos. So establish family routines. The second thing is separate spaces. Reserve spaces for different activities. For example, you might have quiet activities on the first floor and more rambunctious in the basement. Office was for mom and dad's work. But a lot of people don't have that much space, so that's a problem. It's always easy if you have a big house, but it's a lot more challenging, and you have to use your real good skills to figure out what to do. So you might use scheduling combined with that. So the dining room table, for example, might be schoolwork in the morning, quiet play in the afternoon, dinner and family games in the evening. So there's a whole range of things that might be done in the same space. And you might want to do that with all different spaces. But it's a good idea for everybody to know what the expectations are. And again, it goes back to Baumann's ideas that you put on expectations, and you put on these expectations. These are what you're supposed to do. It doesn't always work out, and you don't have to be angry when it doesn't, but it helps guide kids when you have those expectations. And by kids, it's going to vary with a preschooler. It's going to be very different with a teenager, but the same principles are involved. You're going to approach a preschooler quite differently than you're going to approach a teenager. A lot more negotiation and discussion with a teenager. With a preschooler, you're going to be more imposing it because they're not capable of a lot of discussion about these things. Signaling different roles. You notice that tonight I'm wearing a suit and tie. That's because I'm in the role of a presenter. And that's what I do when I'm presenting. I wear a suit and tie. Now, of course, you know that I don't wear suits and ties all the time, but it helps me get into the idea of what I'm doing. But it would also helps your kids to know. Now, obviously, most people around me don't wear suits and ties, but it's a good idea to have if you're going to be doing your work, it's a good idea to have some signal to your family that this is my work outfit and I am doing work now. This is my play with the kids outfit, and that's fine. Or this is my, if depends on how you want to have more than two outfits or two ways of signaling different roles, that's okay. But you gotta have, that helps everybody, helps the kids understand that you're in a different mode now. And that's a strength of helping your children understand and comply with your expectations that they're going to change their behavior when you're working versus when you're ready to play with them or to be their parent and be their father or be their mother. So when you're in your work outfit and you're in your office area, be that just one corner of the living room, that's the time when they're supposed to be more respectful of your time. Now, it won't be 100%, and you have to understand that, but every little bit helps in terms of helping kids understand what to do in this very strange situation we're in. So the next area is using positive discipline. This positive to negative ratio. In general, whenever we interact with kids, most of what we should do should be positive. That should be in our comments, in our demeanor, in what we say, what we do, everything. We should have at least 5 times the positive to the negatives. So it should be a genuine positive, not something that's rote. So it has to be genuine. And that'll vary, of course, with your child. Different children have different temperaments, and you may signal how happy you are with them in one way, and with another child you would do it slightly different. And certainly it's different with younger kids and middle school kids and teenagers. The important thing is that if you're going to be giving a positive to a child, don't put a negative tagline on it. Oh, you did a great job in your schoolwork today. Why aren't you like that all the time? No, that's not a positive. That's a particularly devastating negative, because you start off the child as expecting that you're happy with them, and then you crush them. And you want positives that the child likes. There's no use in telling a child that that they're doing really well at something that they don't like. So, or don't have any desire to do well at. It's true with schoolwork. You want to tell them that they're doing it even if they don't like it, but you want to do it in a way that they enjoy it, that they find it positive. So if it's not positive to them, it's not a positive. This actually is a very good way to treat your partner as well. And the important thing is that this idea of a 5-to-1 ratio has come up a lot in the child parent relationship literature, but it also comes up in the marital literature. It's not bad even for managing other employees if you're in a managerial role, or managing your boss if you give a 5-to-1 ratio. It is much more likely that you will have influence in changing the other person's behavior if you use more positives than negatives, many, many more. Don't sweat the small stuff. We want to ignore minor misbehavior. When we're all on top of each other, it's too easy to notice negative behavior. So many times, of course, when kids are going to school and they're out and about with other kids, they will solve their problems themselves. There's a little squabble and they figure it out. Maybe not in an ideal way, but they figure it out. But if they're underfoot, if you see everything and you hear everything and you can't avoid it, it's very easy for you to be in the situation of picking up on small stuff and saying, well, Eric, you shouldn't be doing that. You shouldn't speak to your sister like that. Or Eric, be this way. Or John, do this or do that. When you wouldn't be doing that if they were out in the playground or out in the backyard or out with other kids. And so it's important to try and ignore small misbehavior. Of course, as I mentioned before, we're all a little bit more cranky, and the kids are also a little bit more cranky. So you want to encourage yourself not to pick up on small things that will make you more cranky, will begin to cause a negative cycle of a negative interaction with your child. Problem solving. Now, we've all heard about problem solving, and there's a couple of things that we do. You brainstorm about all the possibilities, and then you come up with the right solution. The thing is that it's important to reflect on ourselves. Are we the type of person who usually problem solves too fast? So that type of person is sort of impulsive. What they do is that there's a situation in front of them, and then they move too fast. They don't really consider things. And at the other extreme is the problem solver that moves too slow, and they agonize over different ways to do things, and hemming and hawing. And so the person who hems and haws all the time is not going to be a good problem solver. When you problem solve, it's always better to take a positive point of view of the situation than a negative. And so you have to be aware of some of the risks and the negatives, but if you have the balance at least 60-40 towards the positive, you're much more likely to come up with solutions that are positive. So again, some people tend to always look on the sunny side of things, and some people look on the gray side of things, on the rainy side. So if you're the type of person who is always looking on the sunny side, you're lucky. As long as you don't go too far with that. In the extreme, that can be just as debilitating. If you can never see the risks, then you're going to be not do it very well. So you want to start with the trying to figure out whether or not you problem solve too fast or problem solve too slow and hem and haw, or if so, are you impulsive or anxious and avoidant? And are you more positive or are you more negative? And try and moderate your own responses. Then the other thing is to try and figure out what would be a small change. That might be, your child isn't doing well on sticking to the lessons, he finds it difficult. So what would be now they're maybe doing 10 minutes of work on their lessons before they're just, up and around and can't pay attention. It's difficult for some kids to pay attention to this online learning if that's what they're in. So maybe you want to set a goal with your child of trying to do 12 minutes. Don't try for 20 minutes right away. Maybe 12 minutes, and maybe you have a little timer that they can, and then they get some, your positive feedback if they make it to 12 minutes before they get up and walk around the table. So you try that, you see if it works. Maybe it doesn't work the first time. Maybe you got to figure out a different way of doing it. And in your own context and in your own situation, you have to figure it out. There's no one solution for problem solving. And the first solution doesn't always work. In fact, the first solution usually doesn't work. And it's important for both the parent and for the child, when you're trying to figure out a solution to something, to understand that the first solution isn't always going to work, and to also try and make sure that you look at small changes. Most of us try and do big changes. I want to lose 20 pounds. Well, that's not the way it works. I'm sorry, you're human if you fail at that. And most people who say, I want to lose 20 pounds, fail. But if you make a goal of that, I want to lose, a pound a week, you're much more likely to be able to do it. And of course, after 20 weeks, if you're successful with a pound a week, you're going to be 20 pounds lighter. So it's important to look at small changes rather than big changes. Family meals. Family meals are one of the most important things that you can do in COVID and in other situations to bring your family together. Now, you've all seen situations where maybe you have situations where everybody grazes and picks up something, watches TV, does those sorts of things, doesn't do anything together at family, and they don't have a very good time. They get enough food perhaps, but they don't have the wonderful opportunity to learn from each other. You don't have the opportunity to learn from your kids, and your kids don't have the opportunity to learn from you. The family values can be conveyed in the family meal, not in a preachy sort of way, but in terms of trying to move the agenda forward and help your kids do better in life. So there's a couple of easy rules with family meals. There should be a start to the family meal. And in the old days, when everybody said grace, that was a very good start. But maybe what you do is you just have, let's start. That's your family meal. Or maybe you give thanks in some ways that aren't religious. It's individual. Or maybe you say grace. There's nothing wrong with that either. So any type of way to start the family meal is a good thing. The other thing is it's very important have a stop to the meal, because the parents may want to linger for lots of time, but the kids want to get up and do something else. And so in the old days when I was growing up, and I grew up in a family of 10 kids, and there were usually 4 or 5 other people at the table as well. We had a huge long table, and so it was more people than the Waltons. If any of you who are older, you remember the Waltons, the television program. And we always started with grace, and you had to be excused from the table. And so if you wanted to leave the table, you had to ask my father, who was the authoritarian, whether you could be excused. Now, he almost always said yes if the meal was mostly over. So you may want to have it excused from the table, or you may want to just say, well, everybody can go now, or something. And you want to do that before people get too restless, before the kids get too restless. So it may be that you're not finished your meal entirely. And again, you can have small changes over time, that you have the stop to the meal a little bit longer and a little bit longer. But you want to have a beginning and an end to the meal. The other thing is that the thing that you want to do in meals is you don't want to have any negative interaction with the kids. You want to make it as positive as you can. So that's not the time to bring up issues about the kids' misbehavior. This is the time to ask them what they are doing and to talk about how everything that's been going on, the situation in the world, the situation in terms of the weather, the situation in the family, not to bring up negative things. It's very important to turn all screens off. And that means you, Dad, you have to turn your phone off, or put it away, or get it out of the way. So everybody should have their phones off. There should be no television on. There should be nobody watching, picking up their tablet and doing something on their tablet during the meal. Because the purpose of the meal is to eat and to get to know each other. So with those sets of rules, and then you can start doing things like asking your kid open-ended questions. So instead of asking your child, well, what did you do today? Which is pretty closed. I went to school and I played. That doesn't give you much to talk about. You might ask questions like, well, what was your favorite thing today? What was the favorite thing that you did today? Other types of open-ended questions which can't be answered with a yes or no or 2 or 3 words. So the family meals are important. Punishment. So punishment is what we often think of as the most important part of child discipline. In fact, it's the least important part. It's sometimes necessary to punish, to either take something away from a child or have a punishment. The types of punishments that are in the old days used to be used was also physical punishment. Now, most physical punishment is illegal in Canada. The Supreme Court has ruled that you can't hit your child in anger or frustration, that you can't hit your child in any way that bruises them or causes any mark. You can't hit your child in the head. You can't hit a child under 2. You can't hit a child over 12. You can't hit children in general, and they promptly discourage it. Now, most experts in child behavior don't think that you should use physical punishment at all. There are some variations in terms of cultures. In some cultures, it's much more acceptable. So, for example, when we were doing parent training in Vietnam, it was very common. About 95% of parents hit their kids. And so what our goal was is not to eliminate it entirely, but just to drastically reduce it. And of course, never can be used as an excuse for beating. Beating children leaves a mark in their brain and in their DNA that endures. And it's a whole area called epigenetics, that there's clear evidence now that children who have been exposed to these types of trauma, their DNA changes, their expression of their DNA changes. So the types of punishment that are appropriate are things like timeouts, and timeout can be used in many ways, but the best way that we found the timeout to be used is that you put a child in a place where they can't get the same sort of stimulation, might be in on a chair, might be somewhere in a room, but you don't want them to be able to be either harm themselves or that they can entertain themselves. It should be fairly boring. Oftentimes, it's best to put it in the context of, okay, Jake, it's a timeout. I want you to go and sit on the timeout chair, and I want you to think about how you could do something different. So you don't phrase it that because you're a bad boy or anything, you just phrase it, this is time for you to think about things. And we generally suggest that you should use about 1 minute of timeout per year. Below age 3, it doesn't work, and and you have to be judged with your own family what the upper age limit is. But it's not a bad idea for people to go and to think about what they're doing in a calm sort of situation. It gives them a chance to calm down, to think about things. The other type of punishment that's often used is, again, taking away privileges. And taking away privileges, the most common one that I've heard of these days is you take away screen time. You can't play on the tablet or on your phone or whatever. And that can be very effective. It's important to make sure that you don't give the kids taking away a long sentence. So if you take away something for a week, that's a lifetime for many kids. And so it's not likely to be very effective. What have they got to lose for the rest of the week? You've already taken away you're going to add to the sentence, so they take away for a month or a year. It's just not going to work. So very short punishments are more effective rather than very long ones. Now, I want to encourage you to be gentle with your children and be forgiving under these circumstances in particular. It's a good idea all the time to be that way, but under these circumstances, it's particularly important to do that, to be gentle, not to be always thinking that they're trying to get you or trying to make you mad or that they're bad kids. You should be gentle with them. Raising your voice, if you can avoid that, is always a good idea. It's much better to be calm and firm and loving. Going back to what Baumrind talked about in terms of authoritative parents rather than authoritarian. You should also, of course, be gentle with yourself and gentle with your partner. If you have another parent working with you, they may have a different way of doing things, and that's okay, and you try and come to some compromises, but you don't have to always do things exactly the same. It's okay for dad to be a little bit less demanding than mom. That's okay if that's his personality and that's the way he wants to do things. Now, you have to reach some sort of accommodation with the other parent, but you don't have to be exactly the same, and I encourage you to be gentle with the other partner. Finally, we want to talk a little bit about self-care. It's important to especially in this time of COVID, to take care of yourself. Whatever it is that you use to make you feel good, you want to have some small amount of thing every day where you feel good. For some people, it'll be, going outside for a walk or a run, if that's possible in your situation. That's great, because then you combine exercise with self-care. If it's having a time by yourself and reading poetry to yourself, that's fine. If it's taking some time and watching an old football game, not 3 hours perhaps, because then you're exiting your responsibilities, but watching a few of the highlights from an old football game, that's fine. Whatever it is, it's important to you. A massage, if you can get somebody to help massage your temples, like in this picture, that's great too. You want to limit and monitor social media. It's a good idea to do that for yourselves. It's a good idea to do that for your kids. We should be watching what our kids are looking at on social media. We should be aware of it. We can put restrictions on their social media and make sure that they're enforced. But just the amount of time. For ourselves, and for kids, there's been, they can spend hours and hours and hours on social media, and it's a waste of time. When it's, there's some advantages to social media, to keep in touch with friends, but hours doing that is they're going to be spending time comparing themselves in a negative way. They're going to be spending time exposing themselves perhaps to child abuse. There's been an increase in sexual predators on different types of social media. You have to be aware of those things. The other thing is, of course, is if you're on social media all the time learning about terrible things that are happening with COVID, or crazy new cures like drinking bleach to prevent COVID, that's not what you want. Oh no, sometimes you even get that on the national news with some politicians saying that. But the important thing is to monitor the social media. We don't need to know everything there is to know about COVID. We need to know some things. We need to know what's going on. Always the public health, in Ottawa, the Ottawa Public Health, the Ontario Public Health, or your provincial public health site is a good place to get up-to-date news. If you enjoy watching the news, watch the news, for half an hour. Don't spend 3 or 4 hours watching the news about COVID. You're only going to get more worried. Limiting alcohol and drugs. In COVID, as I mentioned, with close contact stress builds, some people use alcohol and drugs to relax. When people use drugs or alcohol to escape from stress, they're likely to get into trouble. When people use alcohol to have a social drink, they don't get into trouble with alcohol. They don't increase their amount of alcohol. So having a glass of wine with with one of your housemates, with your partner, or with somebody else who's living in your house once a day is fine. There's no ill effects to it. But under COVID, there's a risk of overuse. And now overuse is bad because, of course, it's bad for, we lose our skills. We're more likely to get angry. We're more likely to get depressed because alcohol is a depressant, and we're more likely to disturb our sleep. Alcohol has a funny effect on sleep. You can fall asleep faster with some alcohol, but then you wake up and your sleep during your sleep is not as restful, not as restorative. So it's important to limit alcohol and drugs during COVID. Most of the time it's a good idea. It's particularly important to pay attention to that these days. So that's my presentation. I'd be open for any questions and comments. Tomorrow we're going to be releasing 90-second COVID mental health. And if you're interested in it, you can sign up for it, and you'd be able to get twice a week, a short newsletter on specific aspects of mental health during COVID. And I want to thank you very much for your time and attention. And I do want to thank the sponsors, CMAP Health, who I work for as a psychologist, and the Unified CBT Academy, which I took some of their courses, and they're very good. 90-second Health is the startup that I'm just starting. It's being announced tomorrow. That blue logo is for the IWK Health Center, which is the Children's and Women's Hospital in Halifax, where I work, Dalhousie University, and Strongest Families, which I mentioned to you. Thank you very much. And I'm going to... Any questions and answers? I guess I'm supposed to give the answers. You're supposed to give the questions.
Thank you, Pat, for that excellent and well-paced presentation. It was very, very appropriate during these times, but it would apply in many other times. And I have a few questions which I'm sure our listeners would be very interested to know answers to. I'm just wondering, in the current time as in last few years, decades, so life is becoming more and more complex. I like to use the term complexing up, and now with COVID, it's becoming even more complex. I'm just wondering what kind of resources parents can access. So yes, we hear about therapy, CBT, IPT, so many different kinds of therapies. But for the average person who's working hard to bring up their children, what resources can they access for parenting?
In the old days, way back when I was a child, back in the last century and before that, not 2 centuries, I'm not that old, we all had family around us. And family sometimes interfered with child raising, and maybe had a different view, but oftentimes family was a real source of wisdom for child raising. And so even now, talking to your parents about situations, you have to, is very helpful for some people, maybe not so helpful for other people, but going to your parents is not a bad idea. They raised you, and look, you didn't turn out that bad. And so there may be some wisdom in their own thinking. Friends are often a very important part, and you have to choose your friends who you're going to talk to about parenting carefully. You don't want somebody who's going to blame you and say, well, if I had a kid like that, it'd be fine in 20 minutes, and somebody who maybe has shared you may know somebody who's had some of the same types of difficulties, whatever those are. If your child is anxious, somebody who's had an anxious kid, how did they handle that? Somebody who's had a disruptive kid who's very, with ADHD. Your family doctor is sometimes very helpful. Some family doctors are excellent with helping you have ideas. Sometimes it's hard to find a family doctor or find enough time with a family doctor, but that's an important area. There's a lot of sites on a lot of YouTube videos that show you different strategies. And so scanning the YouTube videos to try and figure out, it's important to make a judgment about these things. Do they fit with what my values are? And I think values are really important. So do they fit with my values? If you have a specific religious orientation, sometimes you can find a specific religious orientation for that. But make sure that it fits with your own personal values and get some ideas that way. So those are some of the ways. And of course, there are oftentimes in many communities, when times were a little bit different other than under COVID, there were parenting programs. So COPE was a parenting program that originated by Chuck Cunningham, Professor Cunningham at McMaster, but thousands of people have taken COPE sessions, which are run usually by volunteers, and they're run in community centers or church basements, a couple of, maybe 10 or 12 sessions of how to manage your child. And those are the types of things that you should look for in the community centers, look for maybe in your church, look for in different areas of the community to try and help you. And it's often very important to meet other parents who are and figure out some ways of managing difficulties with your kid.
So we have some more questions coming in. One of the questions, Pat, for you is one of the viewers is wondering if you have any suggestions for parenting very active children during COVID-19.
Yes, well, very active children in confined spaces are a real challenge. I think that you just have to do, the types of things we were talking about, you just have to sort of do them and do them more. So it's even more important, for instance, with a very active child, to try and arrange the environment that helps them pay attention, helps them calm themselves down. So if you possibly can have a place for them to be rambunctious if you're in a house in the backyard where the weather is getting a little bit better, or in a basement where they can be a little bit more rambunctious. Again, then having clear expectations that certain type of behavior is okay in one situation, certain type of behavior is okay in another. They're going to need the rambunctious or the active child is going to need more praise, more positives, because the tendency is they're going to elicit too many negatives. It's very easy with an active child to be always on their back and to be a nag and to be always picking up on little things. So it's really, really important to use that 5-to-1 and maybe even stretch it to 7-to-1 or 10-to-1 in terms of trying to really make sure that your child knows that you care about them, because then they're more likely to do what you want them to do. These things always work in multiple ways. So it'll help their self-esteem if you're positive towards them. And you don't praise things that you don't believe. You find things to give positive feedback on. And then the other thing is that you've got to really try and limit your negatives to those things that are really important. So environmental control, the control of behavior by environment, the control of behavior by positive approaches, and then some judicious rare but judicious punishment when they violate expectations that are really important. But it's hard. You're not going to have an easy solution.
No, that's a number of very good tips. I'm looking through, and I'm wondering, I'll ask my colleague Bonnie to also keep an eye on the questions as they come up. Your microphone is off, Bonnie.
Sorry, I thought I put it on. Thank you. Dr. McGrath, in respect to, the variety of ages, but how would you recommend parents tell their children or speak to them about the pandemic without creating too much fear, but being honest in explaining kind of what is going on?
Yeah, I think that one of the problems with the coverage of the pandemic is that all of the emphasis is on the people who've got the disease and the people who've died. You'd think that that half the world was dying. Well, in actual fact, there are way too many people getting the disease and way too many people dying. But it's important to understand what the actual data are. And the actual data are that actually really a very small percentage of people are dying, a very tiny percent. And so the death, the number of deaths in Canada is still very small. And we have 35 million people here. And if you do the math, your chances of dying from COVID are not very good. You're not likely to die from COVID. So I think it's important for parents to balance the importance of the situation and say, okay, there's this germ, and depending on how old the kids are, this virus, and detail what a virus is, and maybe show pictures of what the virus looks like. There's lots of those around. And then say, and this is a risk for some people more than others. And even, if you're very old, then it's more of a risk if you catch it. But there's a lot of things that we can do, and the government has told us that we're supposed to do a lot of things. Now, that's not because we're very likely to die from it. It's because they want to stop it, and they want to make control of it, and that's a good thing for everybody. So even though the chances of getting coronavirus and getting the COVID-19 is pretty small, it's always important for us to follow those things. But the chances of any one individual is you're more likely actually to get hit by a car in general terms than you are to get COVID. You're more likely to die of other things than you are to die of COVID. It's important if there's, say, a grandparent, to recognize that they are a little bit at more risk, and that's why we can't go and see them right now, and that's why they're they're being very careful. But all of the things that the government has asked us to do, like wash our hands more frequently, like keep a physical distance from other people, that makes us pretty safe. And in actual fact, your grandma, Oma, is very safe. She stays in her home. She's very careful about not going into places that are dangerous. But we have to balance that, danger versus safety. But in actual fact, the data tells us that we're all pretty safe. The risk from COVID is not huge. It's important, and I support the public health interventions, but it's not a huge risk. It's something that our society has deemed that it's important, and we're doing lots of things to make it safe, and it will be safer in the future. I don't know if that balance, telling them, some kids worry a lot, some kids don't worry. The kid that worries a lot, you're going to have to make sure that they understand that the risk is low. Kids that don't worry a lot, you're not going to have to mention that nearly as much.
So thank you. We have a very interesting question. What do you say to an 8-year-old who struggles with positive treats during COVID, feels guilty for having fun while others are suffering?
Okay, that's a very good question. I think the thing is that again, I would go back to your values in the family. Okay, what are your values in the family? If you're very religious and you want to say, well, then you might say things like, well, God wants us to be very positive about these things and doesn't want us to, know that you're not guilty. It's okay. It's a good thing to have positive feelings and to be happy and to have fun. If you're not religious, you might put it in terms of, if you don't believe in God intervening in that way, you might put it in terms of, well, in our family, we all think that it's important to make the best of difficult situations. And it's really important. In fact, it makes everybody happier when you're happy. And so when I see you play and you're enjoying it, when I see you talking to your friends on talking to your cousins on FaceTime and you're enjoying it, that makes me feel better. That means that we're all able to do a better job of helping each other. So you being happy is a way of me being happy. You're helping other people. You're helping your cousins who you talk to on FaceTime. You're helping your grandma that you're speaking to. You're helping other people. So it's not a bad thing at all to be happy. Yes, there are, unfortunate things happening in the world. There are unfortunate things happening. People are dying from this disease, and it is terrible that people die from it. But that's the being happy about playing or being happy about enjoying something. It doesn't increase their risk of dying, doesn't do anything like that. In fact, if your people who know you makes them feel happier and makes us all able to deal with these restrictions that we have, having to stay in, not having to social distance, not being able to go and visit. It makes it a lot easier for me when you're happy, that I know you're happy, and that makes me feel good, and it makes your grandma feel good, it makes your cousins feel good. So it's your job to be happy, and you shouldn't feel guilty about it all. It's part of your job to be happy about things.
So that leads me to another important question, and we always like people who are working on frontline and who bring the experiences. So your colleagues in Strongest Family, they do a lot of parent training, and they must be now dealing with these things with parents, and it's a wonderful resource that they can actually speak to parents from a distance. They don't have to come in. My question linked with those experiences are, parents are struggling, and now it's become a shared struggle. So how do you bring in with parents and the child that it's a shared struggle? So the parent is also a human. They're not just there to discipline and raise the child. They are also facing adversity. So how does that, like your team, when they're working with people, how are they conversing about these things and what are they saying?
Yeah, well, one of the things that we're finding is that when we teach these skills that I was talking about today, one of the things that we're finding is that even in spite of those skills, when we take measures of the child behavior and we take measures of the parent satisfaction with the skills and their ability to implement the skills hasn't changed. In fact, it's very high. Mm-hmm. So that with Strongest Families, which is available in some regions through some regions of Canada, and you can go to the Strongest Families website and see if you can get it. We only sell to government agencies and such, and we also get a lot of support from philanthropy, especially things like Bell Let's Talk. Mm-hmm. So we know that what's been happening, and we were talking about this last night at a board meeting, that the parents are feeling they have the skills, they can do these things, but the kids aren't responding as well. Mm-hmm. And we were having a bit of, our coaches are so dedicated to helping their parents. We're noticing that the coaches were feeling badly about that. Well, under COVID, you're COVID fine. Mm-hmm. You can't expect that things are going to go as well as they would go in usual times. So mm-hmm. You have to cut yourself a little slack. You have to cut your kids a little slack. That things are going to be a little bit more chaotic than you'd like them to be. And an understanding that in this type of extreme situation, that all the best parenting in the world, you're still not going to have as smooth a ride as you would in other situations. So you have to be a little bit more gentle with yourself as a parent, and not to say that you can say, well, it's okay for the kids to go wild or the kids to get really anxious, but you have to do the same sorts of things, but you might not have quite as much of an effect.
Do you feel that kids are feeling some empathy for their parents, for what they are going through?
Well, it varies. Some kids are very empathetic. Now, I as I told you, I grew up in a family I had 9 siblings, and there were 10 of us. I was the second oldest. And, if you look down the SIB line, some were extremely sympathetic and understanding of everything, and some were clueless in terms of those things. So even within my family, you can see, I won't say which ones of my brothers and sisters were clueless and empathetic, but, some of them were that way. And, what's interesting is my brothers and sisters would probably give different names for everybody who was the clueless ones and the ones that were empathetic. My own daughter, who's now in her 30s, is very empathetic. And every time I interact with her, even now, she tells me she reacts in a way. She's happy. She's great in doing things, and she does that. And she's very understanding of the stresses that an old man like me might experience in this social isolation with COVID, because I'm an extrovert, and one of my extrovert friends said, all this lockdown is a plot by the introverts to get back at us, and but it may be more difficult on people who are extroverts, who are used to meeting a lot of different people. And some kids are really good at understanding that, and some kids aren't. And that's not because they're good or bad kids. That's simply because they're wired a little bit differently to pick up on the cues that their parents are experiencing. It's not you want to share with your kids a bit. You don't want to overshare. And that's a judgment, just like you don't talk about your sex life with your kids. You don't talk about maybe your deepest worries or your most extreme anxieties with your kids. And so that it's hard to know in the abstract where it is, but most parents will know, okay, some sharing is good, encouraging empathy. With one kid, they're going to be very empathic. Other kids aren't. If the kid's too empathic, they're going to take on all your worries. You don't want that to happen either. Yeah. And the kid that's a worrying kid, they're wired to worry. You don't want to share, your greatest fears about your mother getting sick and dying, which, if she's taking precautions and she's living in a situation that's safe, are pretty slim too. But you got to judge with the individual.
Thank you, Pat. We've running over as questions.
Oh, I'm sorry.
No,
I
that's
guess
okay.
I talked too much.
No, that's excellent. And I also want to thank the IT team at Snap Clarity and the whole Snap Clarity team who have really taken up this idea of spreading this news during COVID-19. A lot of work goes behind the scene in getting all this done, not just by the speakers, but also by people supporting this. And Snap is doing a lot of work with people by making therapy available in very flexible manner. So thank you to all of you, and good evening. And we'll be coming back with more relevant presentations for you in the forthcoming weeks. And please keep coming with your ideas, what you want us to talk about. Thank you and good night.
Thank you.
Thank you.
Thank you, everybody.